All right, so I'm just going to get right into it. Again, my name is Kimberly Garrett. I am from We Speak Student, and today we are here to discuss the domestic student insurance plan at George Brown College. So WeSpeakStudent.com is the main, excuse me, website that you will be using for your student insurance needs. So you'll go to WeSpeakStudent.com. You are George Brown students. You're going to click on George Brown, and you're going to go into the main page. This is the main page. As I said, today we are doing the domestic student cover information. Tomorrow is the international. If you are international, please pop by tomorrow. But for today, we're just going to go with domestic. So we're going to get right into it. If you click onto domestic students here, it will be everything you need to know for your plan. I know it looks like there's a lot of information, and I mean, there is, because there is lots of information in regards to insurance. That being said, I want you to know that there is absolutely help anytime you need. Of course, the Student Association at George Brown is a wonderful place to go for help, but we too at We Speak Student have a live chat as well as a call center and email that you can access anytime. You can actually access it every day from 8 a.m. to midnight. So any questions that you might have, please feel free to, ask us. I promise on the live chat, there is a real person on the other end. So I do want to start by kind of pointing out the obvious that there are 4 different plans that you can choose from. If you are January start students, then you are able to choose a different plan up until, so from 28 days from now, so the very beginning of February. If you do not do anything, I want you to all rest assured that you are automatically enrolled in this plan. So you pay for it in your tuition. No additional fees are required, even to change your plan, and you are automatically enrolled on the balanced plan. Now, it's called the balanced plan for a reason. It is the most balanced plan. So it kind of has equal amounts of everything that you might need. Now, there are some enhanced options that you can choose from if you are thinking that works best for you. There is no right or wrong choice. It is entirely based on what works best for you. So the enhanced drug plan will, of course, have some additional coverage for drug coverage, enhanced dental plan, more coverage for dental, and enhanced extended healthcare plan, more coverage for extended healthcare. I'm going to just go through the balance plan today. As I said, that's what you're automatically enrolled in, but please feel free to take some time to read through the other options to see if they work for you. So let's just go right to prescription drugs. So prescription drugs, of course, are drugs prescribed by a doctor. For under the balance plan, you have $5,000 maximum, 90% coverage for oral contraception, and then 80% coverage for all additional eligible medication. So, quick math, if it's 80% covered, $100 is your total, you would have to pay 20 and the insurance company would pay 80. Most drugs are covered, allergy serums, insulin supplies, Gardasil vaccine. If you do need any type of prescriptions, you can bring your We Speak student card with you to the pharmacy. They'll be able to put it through for you right away. And the only thing you will have to pay is whatever you owe out of pocket. Moving forward, in dental, the balance plan has $750 of dental coverage. So I know dental sometimes can be a little confusing because there's different types of coverages within it. I always recommend going to the dentist and getting a quote from the dentist prior to receiving your services. The reason for this is, to be honest, dental offices are still a business, so they're wanting to make sure that they can, get as much money as they possibly can. So just so you're not surprised about how much you might need to pay out of pocket, I always recommend asking for a quote. They'll be able to take your, We Speak student card right away as well, put everything through for you, and let you know exactly how much you will have to pay out of pocket at the end of the day. So with $750 maximum, you have 80% coverage for basic and preventative services. You will notice that there is 1 cleaning included, as well as 1 unit of polishing and 2 units of scaling. Fun fact, 1 unit of scaling is equal to 15 minutes of cleaning on your teeth. So that is 1/2 of an hour. If we keep going, we have 75% for minor restorative, as well as extractions and oral surgery. And there's additional coverages for endodontic and major restorative services. As I said, I know dental can get a bit confusing. But typically you'll be in the basic and preventative area. So it was typically 80% coverage. All right, moving into extended health. So extended health, these are paramedical practitioners. So, massage therapists, osteopaths, physiotherapists, psychologists, that all is underneath the paramedical practitioner lens. You'll see under the balance plan, it is 80% covered, up to $25 per treatment, up to $300, which means that you have up to $300 per policy year. But each time that you go receive a treatment, you'll have $25 to go towards that treatment. Now, if you're looking for additional extended health benefits, of course, I would recommend taking a look at the enhanced extended healthcare plan. You'll notice that there is 90% coverage up to $300 per policy year, which means there's no maximum per treatment. If you have any, specific inquiries about this, feel free to ask me at the end. There's lots of information here, but one thing I do want to make sure that you are aware of is the if recommended by a physician note. What that means is you need to have a physician's referral if you are going to see a massage therapist. So just so you know, if you do want to go see a massage therapist, that's no problem. Just go see your family doctor, let them know, they'll be able to give you a note, and then you'll be able to submit that when you submit your claims. Orthopedic supplies is covered, ambulance is covered up to 80%, equipment rental, medical supplies, prosthetic appliances, hearing care, and many other things. As you see, there is lots of coverage available to you, all under the extended healthcare plan. If we keep moving on, we will also see vision coverage. Excuse me. So vision coverage is also eligible under the balance plan, 100% covered up to $65 for an eye exam, and then $100 for prescribed lenses and frames. Now, I do want to mention, if we are all January start students right now, everybody's coverage would have started January 1st, 2022. Can't keep track of the year anymore. So January 1st, 2022. And then it will continue throughout the policy year until August 31st, 2022. If you continue in September, then your coverage will continue September 1st, 2022. And your policy maximums will actually go back to zero. So all these numbers that I'm talking about today are from January 1st, 2022 to August 31st, 2022. The only caveat for that is the vision coverage, and that is actually valid every 24 months. So if you were to go get your eyes checked today, let's say, so January 6th, 2022, you would not be eligible under the George Brown We Speak student plan until January 6th, 2024. For both the extended health and vision claims, it is important to know that you will typically have to pay out of pocket and then submit claims for reimbursement. All right, accident benefits. Not always the most fun benefit to talk about, but a really important one. It's just good to know that you have there. So there's life insurance included, various medical expenses that will be covered if you were to get in an accident, rehabilitation, tutorials, home modifications. So I won't have to read through everything today, and I hope, knock on wood, no one gets in any accidents. But if you were to, unfortunately, be part of an accident, this coverage is available to you in that event. Travel coverage. I know, unfortunately, travel is not as it, has been in the past, but I think we're slowly getting there. So travel coverage is available to you. It is a lifetime maximum of $5 million for trips of up to 120 days. So if you're going for more than 120 days, I'm very jealous. But if you do, you will need to buy, you need personal insurance for yourself. Only thing I do want to also mention, which is very important, is that if you find yourself in a hospital outside of Canada, please make sure that you call the number. It's listed right here. However, it's also on the back of the card, which I will show you shortly. And please call them within 24 hours. The reason I say this is because the insurance company needs time to negotiate with the hospital to make sure that there isn't additional funds that are required for you to pay. So if you don't call, it is possible that you might end up having to pay money out of pocket, and we don't want that for you. So please make sure that you call as soon as you can, or have someone that is close with you call on your behalf. I know a typical elephant in the room question is COVID-19 covered? I'm happy to say that there are no exclusions for COVID-19. So if you were to contract COVID-19 while traveling, as long as you were following all of the government guidelines, then you would be covered absolutely no problem. The only thing that, of course, is required to be paid out of pocket is if you were to need any type of COVID-19 testing for travel requirement purposes. And finally, student wellness program. We have a wonderful student assistance program available to you, which is short-term counseling. This is in addition to your extended health benefits. I know you might not need it right now. You might not need it tomorrow. You might not need it next week. But in the event that you need it in the future, it's just really, really good for you to know that it's there. It is called WeConnect. It is available by phone, email, chat, text, and an app. It is 24/7 counseling available to you. As I said, it's pretty much available in any way that you want to access. You can also go to the website and you can sign up using your email and the institution code. As you'll see here, it is George BR. You can call, and again, you can download the mobile app. So however you want to access, you can speak to a virtual therapist within minutes, 24/7. There is also immediate care available if you are in urgent need. We have various types of additional, personal growth and development courses. There is legal and financial support. So if you're looking to speak to someone about maybe some financial assistance or legal assistance, you can do that through this program. We have life coaching, wellness coaching. So it's pretty much an overall wellness program that is geared towards you. No additional payment is required. It is short-term therapy, but it is available to you whenever you might need it. So please pass this on to your friends as well. It's a really important, wonderful offering that George Brown, Student Association provides to you. All right. As we're going down, if you click on booklets and forms, it's going to take you to what I would say is your most useful page on the website, because this actually shows you exactly how to submit your claims. So as I said before, there are benefit cards that you can use. So here is the domestic student benefit card. This is what you can bring with you when you are going to the pharmacy or the dentist. You'll also see that the WeConnect number is here too. Of course, if we were in person, you'd be able to pick one of these up. But unfortunately, we are all still kind of doing things virtually. So you can print it out online or even save it on your phone. There's also the travel benefits card. I highly recommend printing this out or saving it on your phone when you do travel. This has all the information you need and the phone number you need to contact in the event you find yourself in an emergency situation. There's also a very long booklet available to you. I like to say it is good reading material if you're having problems falling asleep. So this is all information on your coverage, very in-depth details if you need it. Here are all of your claim forms. I'm not going to really click through all of them because I'll actually show you how you can submit online. But if you'd like to fill out a paper form, you can do so online here, or sorry, I shouldn't say online. You can access them online and then send them by mail. The only one that you will need to submit by paper is this accident claim form. You will need to submit this by mail, but everything else you can submit online. If we keep scrolling, we have a wonderful discount network available to you. Who doesn't like some extra savings? If you go to one of our dental network discounts, you can actually get an additional 25% off, which means you would actually have 100% coverage. Of course, it is entirely up to you. If you already have a dentist, feel free to go to that dentist. But if you'd like some additional savings, take a look at our discount network. We also have some wonderful coupons available, videos on submitting your claims, more tutorials, and a frequently asked questions area. You'll notice there's a feedback form at the bottom, but this also includes our website and phone number. So if you'd rather not use a live chat and send an email or call us, please feel free to call us at any of these numbers and someone will get in contact with you pretty much momentarily. Now, you'll notice at the bottom here that there are 3 different options that you can choose from right now as a January start student. You can opt in your family. Your family includes your spouse and dependents, so your children. And you are able to do that for the next 28 days. You'll simply click here, excuse me, you will click on what program you are, so domestic, of course, and then you would have to pay that whatever option you're looking for, and then they will have the exact same coverage as you. If you are looking to opt out because you have additional coverage elsewhere, you are able to do that. You'll simply click again, domestic student. You'd put in your student number and then you would put in the information for your alternative coverage. If you do not have other coverage, you are not able to opt out. Also, if you do have alternative coverage and you don't want to opt out, you absolutely can coordinate your benefits, which means you'll ultimately have double coverage. And personally, I would recommend that option if I was you. And lastly, you can choose your plan. You simply have to put in what program you are, whatever your student number might be, and then you can just simply choose whatever plan works best for you. Again, there's no additional fees required for that, and you can do that for the next 28 days. Now, how to submit your claims online. As I said, you are able to submit your claims online, and I highly recommend doing that as well. There's a little cheat sheet here that tells you exactly how you can submit your claims online, but it is very simple. You simply click on e-profile for online claim submission. You're going to register one time. You're going to fill out the information required, put in your banking details, and then actually you're going to get direct deposit right into your account. It's a lot faster than sending by mail, and it's a lot, easier for you to follow up on your claims. As I said, we do have the wonderful WeConnect option, which is the student assistance program. You can create beginning of the week. You can create a login for yourself on the website. So you would just go through here to do that. You're just going to have to do that one time again, and you can have access to the website. But if you would prefer not to make a login, that's fine too. You can simply call the number which was on the My Wellness program, or sorry, I should say WeConnect Wellness Program tab when we went through your coverage. Last but not least, we do have this wonderful virtual doctors option for you as well. I know things are kind of different these days in regards to wanting to go into walk-in clinics and not. So if you would like to speak to a doctor online, you can do so from the virtual doctors tab, and there is no additional fees required by you. All right, I know I just provided you with lots and lots of information, so thank you for sticking with me. I'm going to stop sharing my screen now, and I'm going to open it up to questions. So, I mean, it's a really small group. Feel free to unmute yourself if you'd like, or ask questions in the chat box. But if you have no questions, I appreciate you taking the time today to listen, and I also hope that you continue to do well. So let me know if you have any questions, and if not, thanks again. All right. Well, it seems like there are no questions. I hope that means that's a good thing. I hope it means I went through it thoroughly. And if not, the contact center is available to you. So if you have a question in a couple minutes that you forgot to ask, please reach out and they can help you as well. All right. Thanks so much, everybody. Have a wonderful day. And I wish you the best 2022. Happy New Year. Bye.